All right, welcome back everyone to another virtual shadowing session at Hearts for Health today. We're excited to have Dr. Khan. She's a pediatric dentist who grew up in Long Island, New York. Actually, I was there for 3 years, coincidentally. But yes, she completed her specialty training and went on to be a pediatric dentist in Maryland, where she now serves as the vice chair of their dentist committee. A quick reminder for a few people who might be new, who are listening. We do have a Q&A at the end, so we do have this presentation just to start off and kick things off with our session. But if you do have any questions, we do have the opportunity to ask those questions to Dr. Khan. I'm sure she'd be more than happy to answer. So please feel free to type in your questions in the chat, and we'll go through them during that time at the very end. Also, if you want to stay tuned with other shadowing sessions, we have more usually on Mondays and Thursdays, and we're going to be continuing through this semester and the next. So two ways you can do that. Either follow us on Instagram, where we post flyers like these. You probably have seen them often through Instagram, or our email listserv is another way to stay in tune with us. They're really the same. Both of them will have flyers released, and you'll be able to get details on both speakers that week. Although on our email listserv, we might have some more opportunities for our other programs. We also do publish other opportunities for our other programs, like our clinical volunteering program, our refugee volunteering program. And there's a few others that we're going to be expanding with actually next semester. So to stay in tune with those, either works, but our email listserv might be a bit better. To join that email listserv, either subscribe to our website. At the very bottom, we have a subscription form. Just fill in your name, your email, click submit, and you'll be ready to go. Or if it's more convenient, you can just email us directly and we can manually add you on. Our email is shadowing.h4h@gmail.com. And like I said, just name, email, click submit or click send, and we will be able to add you onto the listserv for updates weekly on usually Tuesdays. With that said, though, Dr. Khan, feel free to take it away.
Hi, thank you so much, Michael, for the introduction. It is absolutely wonderful, this program that you and Mary and the rest of your committee have created for aspiring pre-health students. I know when I was applying to dental school quite a few years ago, many of these opportunities didn't exist. And I think in light of COVID, this is a really great way for students to get exposure to health professionals outside of their geographic area. And this is wonderful. So I'm very excited to talk to you guys tonight about my life as a pediatric dentist. Go ahead. So tonight we're going to talk about dentistry through my eyes. I'm going to go over my pre-dental, dental school, and public health experience. I'm going to go through some of my work history because what you'll learn soon is that I did graduate dental school in 2016, but since then I've had dental licenses in 4 different states. So that is definitely unique. I'm going to talk about my involvement in organized dentistry. I'm going to go ahead and talk a little bit about my new venture into dentistry and social media. And in between all that, I'm going to talk about some clinical cases and some clinical pearls and some interesting things that I see on my day-to-day as a pediatric dentist. So what is pediatric dentistry? So pediatric dentistry is the only age-defined specialty in the field of dentistry. Many other fields in dentistry focus on particular disease pathologies as well as parts of the oral cavity. For example, periodontics is the study of the gums and the bones, whereas endodontics is the study of root canal systems. But as a pediatric dentist, you're essentially a general dentist for a specific population. So we provide comprehensive dental care through kids starting with 0 all the way up to at least 21. It depends exactly on the practice modality that you work in. But as you can imagine, an infant versus an adolescent to an adult, everybody has very different challenges and very different needs. So I find that extremely interesting, and it does help to keep a lot of variety in my day. There will be often times where I see a 4-year-old, and right afterwards, I'll go ahead and see a 13-year-old, and their temperament, their needs, their wants, their fears are all different. So it's really exciting but challenging to navigate. And another thing that's wonderful about pediatric dentistry is that we are also trained in seeing special healthcare needs populations, many patients with very complex medical histories, as well as some syndromes. Pediatric dentists are actually the providers that provide care for them. So this is a case in which we also see adult populations. why a pediatric dentist would see patients with special healthcare needs is that we are trained with that during our training, and we often have advanced behavioral modification techniques and tools, pharmacologic and non-pharmacologic, that we are experts in. So oftentimes we can help treat our patients. So I did want to share this cute picture of a very nice thank you card that I got from one of my patients. This particular patient was very sweet, but she was definitely very anxious. And myself, my dental assistant, and her, we kind of worked together through several dental appointments. And at the last time that I saw her, I got a very sweet card. And these types of things really warm your heart and create a lot of value in the profession. So why dentistry? I'm just going to kind of go ahead and describe some of my journey into this. So this is actually a picture of myself in kindergarten. And in kindergarten, I actually won second place in a Colgate citywide competition about oral health. I was not interested in being a dentist at this time. I actually, in kindergarten, I wanted to become a tornado chaser, but I had a flair for art, and I was always into kind of encouraging people to have positive, healthy habits. So in the back, I'm in my mom's lap there, and you can see this little portrait that I drew of this girl, and with a cute poem that says tooth decay, brush and floss every day. So actually, when I got into dental school, my mom reminded me of this, and then she actually gave me a $75 check that I got when I won this competition. It was a bond, so I was actually able to cash it about 20 years later. So that was really nice. So for me, dentistry is very personal. I was born missing one of my front teeth. So as you can imagine, growing up, going through school, that I had a lot of self-confidence issues with that because I was missing a front tooth. My smile wasn't as perfect as it should be. So I did actually suffer some bullying, and I had a lot of self-esteem issues. So between orthodontics that I've had for at least 3 to 4 years, because I had a horrible thumb sucking habit until the age of 8. So I did require a lot of orthodontic care, not only to correct the downstream sequelae of that thumb sucking habit, but also to create space for a dental implant that I eventually got at 18. I spent a lot of time at the dentist. And as a kid and growing up, I was always very talkative and inquisitive, and I loved going to the dentist and how they made me feel, how like they would listen to my questions and answer any things I was inquisitive about. So I had a very positive experience going to the dentist growing up. I did actually, when I started undergrad, I had a major in biology, and I was interested in health sciences as a whole, but there are a couple of things that came up on the way, which I'll talk about, that made me very interested in dentistry specifically. One thing that drew me to dentistry first was that it's a nice marriage of art and science. I love the fact that I was able to do tangible things with my hands while still taking part in the critical thinking that comes with being a doctor through like the scientific method. I loved the ability to make a difference in somebody's life, just like my dentist, my oral surgeon, my general dentist, my orthodontist made in my life. And I thought that it was a great way to approach one of the most common chronic illnesses that children, but adults also face, which is dental caries. So I like to make dentistry a lot very fun, and especially treating children. We have to find creative ways to talk about things that are often a little bit scary. So now that Halloween is coming, one of the things that I love to talk to my patients about is this particular x-ray. So this is called a panoramic x-ray. It's taken usually around the age of 6, and it's very important to assess the patient's growth and development. So this always kind of freaks kids out, and some of the kids are very interested in it. So as you can see over here, let me see if I can get the pointer. Oh, that did not do what I want. Okay, I'm sorry, that didn't do what I wanted it to do. But you can see over here, this is called a panoramic x-ray. So it essentially takes a photograph and radiograph of your maxilla as well as your mandible. And as you can also see here, you can see a lot of other important anatomic structures when we learned about the panoramic X-ray in dental school, we learned about all those lines that are you see at the top of the image, as well as anything you see at the side of the image. I'm not going to bore you with that, but the cool thing about this is that just by looking at this picture, I do know how old this patient is, but you can guess how old the patient is based on the growth and development pattern. So especially if a kid is nervous and they're a little anxious and they're not really maintaining eye contact with me, I kind of like to break the ice and say, hey, do you want to see a picture of your skeleton? And then I joke with them, I can guess how old you are based on this radiograph. And oftentimes that kind of breaks the ice with the patients. So here you can see the patient's adult dentition as well as the patient's primary teeth, which are called baby teeth or milk teeth. And it shows the adult teeth developing underneath the baby teeth. So oftentimes for parents, more importantly than children, it's a great learning opportunity to show them that, we do have these baby teeth, and it is a great opportunity for you as an adult and to educate your child about the importance of maintaining these baby teeth as a test round, because the adult teeth are there, the adult teeth are developing, and any good habits that you establish now will really impact you downstream. So I remember I took a screenshot of this picture of this X-ray particularly, and I saved it on my phone. And you'll find if you do end up becoming a dentist, you'll have way too many pictures of X-rays on your phone, as well as pictures of your patient's mouth, as well as, unfortunately, some of your friends and family members' mouths when people, do a curbside consult for you via text message. So this patient in particular, she came in for a huge, huge swelling on the lower left mandible, which is the lower jaw. And, I had seen her very recently for a recall exam. We had treated any dental needs that she had. So that swelling was very, pretty confusing to me. And to this day, unfortunately, I still haven't isolated the exact cause of the swelling, but the patient was put on a course of antibiotics. And what myself and one of my coworkers ended up coming to the conclusion that the patient had a loose tooth. Loose baby teeth normally don't cause any type of swelling or infection, but loose teeth create a situation in which patients are often not as keen on keeping that area clean. So when food and bacteria build up in that area, I think some of that bacteria must have gotten embedded into the gums, and that must have caused, an extra oral manifestation of swelling. Luckily, the swelling was able to be controlled with a course of antibiotics and actually removing that loose tooth, because the patient's oral hygiene in that area was pretty terrible, which means that the patient wasn't brushing in the area. The gingiva was very red and inflamed and tender, and as well as we could see a bunch of food buildup and plaque on her teeth. So that was at least an interesting case for me, and it was a great learning experience that sometimes things that you learn in the textbook or things that you learn in the classroom may present to you in person, but the cause and the etiology of the pathology doesn't always line up. So dentistry in general, any type of healthcare field, you're always encouraged to think outside of the box and think of different reasons why something is happening. So as far as my undergraduate experience, I went to Stony Brook University, which is a state school on Long Island in New York. I graduated in 2012 with a Bachelor's of Science in Biology with a research distinction. Undergraduate was a great experience. I focused very heavily on biology classes because that's what I love, and I did complete my pre-dental requirements in addition to, many more extra biology classes. Hindsight is definitely 2020. My thought process of doing a biology major was that if I did want to go into dental school or medical school or any of the other allied health professionals, I would have already had my prerequisites done with the major requirements, and I would have the ability to kind of take some classes at an undergraduate level that would help me in dental school. Now that I'm thinking back to it, I probably would have majored in something else, because we are going to spend the rest of our lives, learning about science, learning about biology, pathology, anatomy, all those subjects. But undergrad is an experience where you can learn something new. So I do always encourage pre-health students at the undergrad level, definitely get your requirements and take extra classes like biochemistry, anatomy. There's a whole list of classes that can be beneficial to you when you enter medical school, dental school, or any of the other allied health professionals. But undergrad is an opportunity for you to learn about other things. And I think what makes a well-rounded doctor is somebody who is able to critically think about things. And I think by learning other subjects, history, economics, philosophy, I had some friends that I went to dental school with that were like art majors, writing majors. You become more well-rounded, and I think it allows your right brain to develop, and I think that encourages you to think differently about things in the scientific process. But obviously you have to do what you're interested in, what you feel passionate about. But if I were to go back, I probably would have majored in something else. I was pretty busy in undergrad as far as my life outside of the classroom. I was very keen on volunteering and community service. I had lots of opportunities at Stony Brook to engage in various community service opportunities. And luckily, Stony Brook University did have a dental school as well. So I had the opportunity to volunteer at the dental school. And what that consisted of was putting on a mask, putting on a gown, and kind of just watching somebody else do dentistry, which now I find incredibly hard and kind of boring to do since I'm now a dentist. But when I was an undergrad, it was honestly one of the most fascinating things to experience. I found it so amazing how a dentist or a dental student had all this confidence and was able to do procedures for their patients. And I kind of learned a lot of dentistry that way. I actually did shadow my own general dentist that I worked with closely to help me get my implants. So I found that to be a nice full circle experience. I always encourage any type of students that are interested in pursuing any type of degree after undergrad to engage in leadership experience. And at least my opinion is that you don't necessarily have to be president of your pre-dental club or pre-med club. Only one person can do that. But I think it is important in other areas where you have interest to exhibit leadership experience, because not only does it show that you're somebody that has organizational skills, communication skills, but those types of leadership skills will absolutely help throughout your profession and throughout your career. I was a big fan of actually doing blogging, and it sounds so silly talking about this now, but Stony Brook University, their admissions department had a blog where basically different students talked about their life as an undergrad for high school students. So that was almost a decade ago, and I would do blogs, and I would actually do these live sessions as well with one of the directors of the admissions department. And thinking about that this morning as I was rehearsing. So I'd come online with the admissions representative. We would go through a PowerPoint and we would kind of answer questions. And it's funny how things kind of come full circle, because that's something I regularly do now. I was also a teacher's assistant, and in addition, I did some research. Research is a tricky thing. I feel like a lot of students shy away from research because it can be a little bit intimidating. My own experience with becoming a researcher and becoming a part of a lab was extremely stressful. I started working in this one lab. I had talked to the researcher, and we were all set to work on things. And it was very important, not only for me because I wanted to do research, but also it was important because it was something that I know dental schools looked highly upon. And I also needed a research project for my honors college senior thesis. So about a week before I was going to start officially working in the lab, the professor got a grant at another university, and he was leaving in a week. So I had to scramble. And that was very stressful. I'm sure all of you guys have stressful experiences like that. And at that moment, it felt like it was the worst thing in the world. But, after grieving a little bit, crying, complaining, going through the normal bouts of being upset about something, I was luckily able to find another opportunity, which actually kind of changed my career trajectory. It was my first introduction into pediatric dentistry and public health, and it ended up really framing how things would go going forward. And initially, when I wanted to do research, I was so keen on doing bench research in the particular project I would be working on, I would be doing bench research, working in a lab, talking about periodontal disease risk factors and how it affects atherosclerosis, which is the buildup of plaque in your arteries. And I was very excited about that because I was going to be trained to do bench research, and then that kind of fell apart. And I don't think to this day that I would ever want to do that type of research again. So life kind of throws you obstacles sometimes, and you kind of just have to rise above it. It sounds difficult when you're in that situation. And I've had issues like that in undergrad and even recently in my career, but I always try to think of it as a learning opportunity, whether I do so in that situation or I do so later. Hindsight is always 2020. So I'm kind of happy with how everything went. So as far as applying to dental school is definitely very intimidating. And one of the things that I tell pre-dents that I talk to all the time about this, it's best to be organized and be early. Dental schools do have kind of set deadlines as far as when applications open and when they start to give in interviews. But I do think that every dental school has different requirements, different supplemental applications, small little nuances. And by applying early, you give yourself a buffer zone. And I think that's really important, that you have that extra time to, for example, submit a supplemental application, or even even indicate that you're taking another course the following semester that the dental school or the medical school requires. So I feel like that was the key, at least as when I was applying to dental school. I'm not sure what the exact trend is now. I think with social media and Instagram being a big thing, I think that's where pre-health students turn to a lot as far as their advice and their tips. But Student Doctor Network was a big thing when I was applying to dental school. And that's a forum in which people post things about their dental school experiences or their application cycles. And I found going to that website to be especially draining, because there would be students there that at least I felt were kind of just fishing for compliments or positive encouragement. They would post very high GPAs, very high DAT scores, and would say, oh my God, am I going to get into dental school? And oftentimes, at least I would compare myself to that particular student, and I would not be at their level. And I would feel so incredibly discouraged that I would not receive an interview because they didn't. And in some cases, I did receive an interview. So dental school, when you're applying, it's the whole package. And you want to make sure that not only your grades are good, your DAT score is good, but also that you're involved outside of the classroom. Healthcare is not just about being intelligent or being smart. It's about being personable, being resilient, and all those types of things can really shine on your application. I think your personal statement is a great way for you to tell your own story. I know I told my story about my own dental experience during my personal story because that is what drove me. And especially if you're writing your personal statement genuinely and you have passion, that can be a great asset to your application. Another thing that was particular to me that I wanted to talk about was the dental admissions test. I actually took it twice, and the second time I took it almost on a whim, if that makes sense. I decided maybe 4 weeks before that I wanted to take it because I was unhappy with particularly my biology score of my DAT. As a bio major, I didn't score as well as I wanted to. I got a 19 the first time I took it, and I was honestly disappointed in myself. I was like, I cannot put an application out here as a biology major with this score. So I was like, okay, I'm going to register for a day 4 weeks in advance. And then I kind of buckled down and studied. And thankfully, I did a lot better. My biology score rose by 5 points. I got a 24. And then a lot of my other scores went up as well. It may have been a part of studying better the second time around, or honestly, I think a lot of it was that I had progressed further in my undergraduate degree. I took my DAT for the second time as a junior. So I had learned more, I had learned to critically think more, and I think I was honestly just more prepared. So the moral of that story is that if you do feel like you can do better, I would definitely, take that plunge, take that opportunity, and rise to the occasion and see if you can do better. Because dental schools and medical schools and other allied health professional schools definitely see that students try, and if they improve, even if it's a minor improvement, I think that does show a lot about your resilience and your determination. So some dental school interview tips. Before I talk about those, I did want to talk about a funny case that came in at one of my last weeks of dental school. Just a little overview. This here, what you see to the right-hand side is anterior bridge. So anterior means the front of the mouth, and a bridge is basically a fixed prosthodontic that helps to replace any missing teeth or teeth that are functionally or aesthetically not looking nice. And if you can observe closely here, all the way to the right of the PowerPoint by that yellow border, if you look closely at the crown, you can actually see part of the tooth inside, not only on the right side and the left side. And this patient came in to me, a nice, like 70-year-old man, frantic. He was like, my granddaughter is getting married. This came out. I need you to glue it back in. And what I had learned through dental school at that point is that this is not something that you can glue back in. The patient's tooth was pretty much completely broken, and there was no way to replace this for the patient in a timely manner for it to make up for the patient to be able to go to their granddaughter's wedding and have a beautiful smile. And we know how important that is for your self-confidence, your ability to eat, your ability to function. And we had to find a solution for this patient. I feel like I had to put on my thinking cap, because obviously there's the short-term solution and then there's the long-term solution. At least the patient, their chief complaint was, I want to be able to smile again. Luckily, my attending that I worked with was very creative. So he noticed that the patient actually had a lower denture and was using denture adhesive for it, which is the sticky, gluey consistency that kind of helps different dental appliances stay in the mouth. So my supervising doctor was like, if this is just for pictures and smiling, know that you can't bite into steak, you can't bite into anything with this. You can put a little denture adhesive on the sides of this and then, put it in your mouth for pictures. And this actually really helped gain the patient's confidence and the patient's trust. So this was a patient that we learned later that hadn't been to the dentist in actually several decades because of fear and a bad experience at the dentist later. So the fact that we were able to earn the patient's trust by listening to them, listening to their chief complaint and kind of addressing that problem, but also creating a long-term solution was really great for the patient. Unfortunately, I graduated before I could see the case kind of turn over, but I do, from what I've heard from the new fourth-year dental student that was going to see this patient, that the patient did end up getting something more permanent that was not only functional, but also aesthetic for them. So dental school interview tips, like first of all, congratulations. The admissions committee has reviewed your application. They think you're a qualified applicant and they want to speak to you. So at this point, you just want to kind of be yourself. You want to show up, you want to be prepared, be kind, and be excited. And now that I've been on the other side of things, where I've actually interviewed dental students, interviewed residents, not only for general practice residency, but also pediatric residency, I personally like, and I've heard feedback from my more senior doctors, that you want to present yourself in a way that they can see you as working as a part of the team. Dental school is incredibly, incredibly challenging. You will have moments of happiness, but you will also have moments where you feel like all hope is lost. And I think your ability to work with others, communicate with others, be a team, that really helps, and that carries through a lot on your interview. You want to be genuine and you want to be excited. I think being prepared is very important. Many students, especially I've found in my experience, students that are applying a few times, they tend not to, or at least some examples that I've seen, they're not as familiar with their resume and their extracurriculars as they should be. Some people on the admissions committee actually take detailed notes and read over your resume and your personal statement in a very detailed manner. So if they ask you a question and you're not able to come up with an answer, that's a red flag. Anything that you put on your resume or your personal statement is fair game as far as talking about it. And you should always be able to talk about it confidently and truthfully. because these admissions committee members do review hundreds of applications every year, and they're able to kind of see what you've done and whether or not you're embellishing anything or you're speaking truthfully. Another thing is be kind, especially on dental school interviews. Many of them happen all day long. So you start off with some type of breakfast, you often have a tour, sometimes you get to shadow. And while they say not everything is being counted for your interview, everybody is taking note. You want to be mindful of what you're doing, your posture, make sure you're not on your phone or on your watch. You want to be engaged and kind of participating in everything, especially dental students. More and more, they're taking the input of dental students as far as during the interview day, because dental students want other dental students that they can work with, somebody that's a team player, somebody that they can get along with, somebody that's going to help them when they need help. And lastly, be excited, like you've made it. The fact that you're interviewing means that people are interested in hearing your story and hearing what you're talking about, and your goal is to impress them. And also, more importantly than admissions committee members interviewing you, you're also interviewing the dental school. Dental schools have very similar curriculums, and that's kind of through accreditation and through the CODA, which is the Commission on Dental Accreditation, and they set certain standards. But every dental school is different. Every dental school emphasizes certain things. So also take it as an opportunity to understand what you want in the dental school. And I think a great way to learn that is talk to other dental students. Don't be shy about asking dental students for their contact information, especially dental students that are willing to give a tour or willing to participate in interviews are usually genuinely interested in helping the future dental students. So as far as considerations when choosing a dental school to attend, I was fortunate enough to have a few choices as far as where I attended dental school. And I actually, my acceptance to Stony Brook came pretty late in the cycle. I had paid the deposit for actually UPenn prior to, and then I got admission to Stony Brook later. So I had to go through that decision. Location can definitely be important to some people, especially if you have family and commitments to other aspects of your life. Reputation is important. I would say reputation is much more important if you're more interested in going to a purely science-based, research-based future. If you do want to pursue clinical dentistry and be a clinician, that's not as important. Tuition, I think, is an incredibly important factor to consider, and was one of the main factors that I considered when I decided to attend Stony Brook School of Dental Medicine. The tuition, even at that time, for a state school versus private schools, the difference was on the was about $150,000 with interest and compounding interest that ends up really adding up. So for me, it was very important to kind of reduce that financial burden on myself. Certain dental schools really emphasized community service opportunities. Stony Brook Dental School has multiple international opportunities, which I found to be one of the main reasons that drew me to Stony Brook. I actually had the opportunity to go to Chile during my third year of dental school, where for over 2 weeks we provided dental care to a small town called Neltume in Chile, which was amazing. You want to look into research opportunities, especially since I did research in dental school. My supervising research dentist did say that if I was interested in attending Stony Brook, I would have the opportunity to continue my research with him. So I thought that was a huge plus. For me, as you'll see, I am very interested in public health and focusing on the macro level of medicine and dentistry. So for me, I was definitely looking for dental schools that had the opportunity for me to do combined degree programs. You want to look into the fact that whether or not the school has postgraduate specialty programs. And this is a controversial one. Some students feel, or the thought is that if there is a postgraduate program, dental students will have less of an opportunity to do more complex cases. But I found it to be the other way around. I found the fact that there are postgraduate specialty programs gave me a lot of opportunities to talk to these postgraduates. And a postgraduate is somebody who's graduated dental school and now they're pursuing a specialty residency. So especially on my time when my patient didn't show up, it was very easy for me to go to the postgraduate clinic and kind of observe those other postgraduate dental residents and talk to them about what they're doing and why they're interested in their specialty. And another thing that's important is gut. You go where you feel is right, and always trust your instinct. I find that oftentimes, at least I did, I talked to a lot of people about where I should attend dental school, especially when I was narrowing it down to 1 or 2 places. And everybody's opinion is everybody's opinion. So I felt like sometimes when there's too many opinions, it often clouds your own judgment. So often always rely on your own instinct. And ultimately the best dental school is the one that you decide to go to and the one that you graduate from. Another important thing that I forgot to mention when you're interviewing for dental school is that please make sure that after you attend an interview, you are writing down some thoughts after the interview, just because if you do have the opportunity to have multiple interviews, they kind of all meld together. And when you're trying to make your decision, it's difficult to distinguish things, especially because oftentimes the information that's available on websites or any type of brochures you got in are not as detailed as what you would have received in person during the interview. So I just wanted to talk about one of my favorite patients from dental school. I'm lucky enough, and I think a lot of dentists are lucky enough to get a lot of sweet cards and notes from patients, and I used to save them all, but I'm trying to live a more minimalist lifestyle. So now I've started to take pictures of them and throw away the actual physical document. But this is from one of my patients. This is actually not a child. This is he was a 20-something-year-old man. He was, I believe, 29 when he first started seeing me. And this guy, he had a serious addiction to different substances. He was going through rehabilitation. He had an addiction to alcohol, as well as a couple of other illicit drugs. So his oral health, because of those factors, was quite poor. Not only did he not have the knowledge and the health literacy as far as taking care of his teeth, unfortunately, his lifestyle choices had really deteriorated his teeth, as well as his periodontal health, which is the health of the gum. So when he came into my operatory, or my bay as we call it in dental school, I was a second-year dental student and super overwhelmed with his case. He had his full adult dentition, and at least 75% of his teeth needed work. Not only that, this sweet patient, he had a severe needle phobia, which was very strange given the fact that he had 2 sleeves of tattoos and tattoos on his neck as well. And that's something that we see pretty common in dentistry, is that patients that have multiple piercings and multiple tattoos tend to have a phobia as far as needles inside their mouth. So that's something that we worked through. The first couple of visits with him, honestly, was just establishing trust and figuring out a treatment plan. In dental school, you tend to approach treatment planning, which is understanding what the patient's diagnoses are and what treatment needs. It's very regimented, and it follows a very strict protocol. So it did take quite a few appointments to actually start his treatment. But when we did, things that we thought were going to happen didn't happen. So we had to think on our feet. And my patient's one request, which unfortunately I wasn't able to fulfill before graduation, was that he wanted a gold tooth in the front because he wanted to look like a pirate. But I did pass that case down to one of my littles, and I do believe that she was able to grant him his wish for his gold tooth. And the most wonderful thing about this patient is that when he first started, in the middle of our treatment, I was like, we developed more of a friendship and some more trust. And I was like, what changed things for you? And he talked about the fact that he loves food, and he couldn't enjoy the food he wanted to because he had a lot of pain in his mouth. And that's what kind of got him thinking about taking care of his dental health. And he's like, what was wonderful is that by establishing his dental health, he was able to get his entire systemic health in check. So in the process of seeing him, he actually finished his rehab and he enrolled in a school where he actually is now a counselor for talking to other disadvantaged youths about substance abuse problems. So he kind of made a 360, and that was really wonderful to see. And I do think about him pretty frequently because he was one of those patients that I remember very dearly from dental school. So in dental school, I also had the opportunity to pursue my master's in public health. Now looking back at it, when people ask me why, I like to joke and say I'm a glutton for punishment. So I would have dental school classes generally in the morning from 8 to 5 p.m. And then 2 or 3 times a week, I would go to my master's classes in the evening from 5:30 to 8:30. So as you can imagine, my schedule was crazy, but it was really rewarding. I found it to be an incredibly refreshing break from dental school. When you're in dental school, you're focused on millimeters at a time. And that's what all dentistry is about. Small, small, small things. Teeth are pretty small, and the work that we do on teeth is even more minute and small. And I found myself struggling with just treating one tooth at a time and not addressing larger issues that relate to a patient's oral health. So we had the opportunity to apply for a master's in public health, and I'm very thankful that I gained admission, and I was also able to have a scholarship for my master's, and it was one of the things that I looked most forward to in dental school. I found it great to talk to other health professionals, and there were not only health professionals in my classes. I found it great because there were people in all different stages of their lives, students younger than me, students significantly older than me. Actually, one of my dental school professors was one of my classmates in dental school. So I had to go from calling her doctor during the daytime to calling her by her first name in the evening. So that was really interesting, and it kind of changed our relationship. And I saw her more as a colleague as opposed to a senior. And by talking to the different peers, I kind of realized that dentistry does have a home in the overall healthcare system when often it's viewed separately. And this is a really nice picture. I got a chance to take a panoramic picture of our HSC, which is our health science center, with a sunset on one side and actually a rainbow and the moon on the other side. So this was something that gives me fond memories about my time at the HSC. Like a little personal fact about myself, I actually did meet my husband in dental school. He was a medical student, and we had the opportunity to take a lot of classes together. And we spent a lot of time studying and hanging out at the library at the HSC. So this picture always reminds me of those fond but hardworking memories. So after dental school, I graduated dental school in New York State, and I intended to practice in New York State. So in New York State, one of the requirements to be a licensed dentist after dental school is that you are required to do a 1-year general practice residency. Some other states, I believe Connecticut requires that. And the list is constantly changing. Other states, in order to become eligible for licensure, you do have to take the ADAX exam, which is a live patient exam, in addition to a typodont portion. But that's constantly changing. I think the trend, due to some ethical issues, is to shy away from those live patient exams. But I was required to do a general practice residency to practice in New York State. So I applied similarly to how you apply to dental school, and it's a match process similar to medical school. So I matched at New York Presbyterian Weill Cornell Medical Center, and that's in Manhattan, New York. And I had a great experience. A general practice residency, even if you are not required to do one by your state licensure, I do highly recommend it. It's not like a 5th year of dental school. It's kind of a nice hybrid between going out into private practice and being in dental school. You have more autonomy than you did in dental school, meaning that professors are not checking in on you with every single step, but you do have a great like umbrella in case like you need some help or you need some coverage. General practice residencies are generally very similar in that you need, there's certain requirements. So there's an anesthesia rotation, there's an oral surgery rotation, there's actually also a pediatric dentistry rotation. And something that I loved about my program is that there was a rotation at Memorial Sloan Kettering, and you were able to be on their dental service for patients receiving on-call different chemotherapies. And I found that to be a very unique opportunity. And luckily I had the chance to do that. I think especially for general practice residencies, it's very important to, during the interview, talk about what you specifically want. I knew coming out of dental school that I was interested in pediatric dentistry, but not so much so that it would be my only focus. I did want to have a great hospital experience, and the opportunity to work in Memorial Sloan Kettering was huge for me. I know one thing about my particular residency that a lot of dental students consider to be a negative is that we did not have the opportunity to place implants during our general practice residency. Dental students generally don't have the opportunity to do so during dental school. So a lot of students want to do that during residency. And for me, I was okay with that because I knew that after dental school, I could take some continuing education classes and learn how to do that. But I did want to be in a hospital-based program, especially after my public health degree. I wanted to find the place for dentists in a larger healthcare system, and this allowed me to do so. So like I was saying before, we do have a few different rotations, and the goal of a general practice residency is to gain experience in advanced crown and bridge work, removable prosthetics, implant prosthetics, routine and complex endodontic procedures, and periodontal procedures. So I wanted to share a picture of my first and only veneer case. And looking at this case now, I can't even look at it because there are so many things that I would change. But this patient here was a nice woman. She was in her, she was a middle-aged woman, and she was just really concerned about her front teeth. And that was her concern. And just kind of going through these clinical images here, the top image is the before and the bottom image is the after. And you can see over there that she has some spaces in between her teeth. And when a mouth tends to look like this, it's not due to the normal morphology and the spaces in between the teeth. It's usually due to periodontal disease, in which the gums and the bones of the teeth are compromised. And I like to compare the analogy to a house. So if a house is built on a poor foundation, the house cannot stand. And the foundation for teeth and the roots are the gums. So this patient obviously over here has lost some of her healthy bone as well as her healthy gum, and her teeth are compromised in that area. In order to kind of successfully go through this patient case, I did need to have clearance from a periodontist that says, her teeth are sound to receive some type of aesthetic restoration, because aesthetics are generally last in dentistry, which I found unique. Usually dentistry starts off by making sure that the patient's gums are healthy and that any disease is treated, there's no pathology, and aesthetics are last. So after we did some treatment planning, we got to this stage, and I was able to prepare her teeth from some veneers, and then we were able to deliver some veneers that closed her gaps. We did inform her that her teeth would look large, a little chiclet-like, but she was happy with the mock-up that we did for her. And this is my first and only veneer case. I usually don't share it because looking at it now, it's not ideal, but the patient was happy and none of her dental health was compromised. So I wanted to share that. And then, hooray, I got my first job. So during my general practice residency, I actually got married. My husband was doing his residency in Philadelphia at that time. So after I finished my general practice residency, I moved to Philadelphia, and I worked in a multi-specialty dental office in the Philadelphia metro area. I actually practiced as a general dentist for 6 to 8 months, and I found myself to be pretty unhappy. I struggled with going work every day, and I struggled with treating patients. Oftentimes patients that I would treat would come in with mouths that needed so much dental work. And the way I like to practice, at least, is that I like to talk to patients about how they got where they are today, especially if their dental health is poor. And a lot of these patients would cite poor traumatic childhood experiences. And that got me thinking. And then I remember I saw this very sweet 12-year-old girl, and she was a recent immigrant, and at the age of 12, even teeth that she just had gotten in her mouth 1 or 2 years ago were severely decayed. And her family's oral health literacy was just so low. She didn't know how to take care of her teeth. She didn't know the things to eat. So that got me more thinking. So I actually decided to apply for pediatric dental residency, and I delayed it by a year so I can match up applying with my husband, who was applying for fellowship. I'll talk a little bit about that later. But the really great thing is that within my job, I had the opportunity to pivot. So given my experience in dental school and given my experience in my GPR residency, I was pretty comfortable treating children. So there was a dentist that was treating children, and he was actually leaving his position. So I had the opportunity to practice pediatric dentistry as a general dentist. As a general dentist, if you are limiting your practice to kids, you can't advertise or mention or talk about yourself like a pediatric dentist. You're a general dentist that's limited to kids. So for the last year and a half that I was practicing in this practice in Philadelphia, I had the opportunity to practice as a dentist that was just seeing kids, which is great. And then at that time, I realized that I do not know anything, and that if I do want to be a pediatric dentist that practices, evidence-based dentistry and provides the best clinical care to my patients and have all the tools in my toolbox, I would need to specialize. So I decided to apply in pediatric residency. And this picture, I remember I took it around the time when I was deciding when to apply. So if you look all the way to the right side of this image, you see a tooth that's kind of rotated a little bit. And for the longest time, I was like, wow, I found a great clinical case. I should publish this. And now that I'm looking back on it, I know why this happened. But when I saw it as a general dentist, I couldn't figure out why this happened. And I think that it's very important to know why something happens before you treat it. So looking back at this, I look at this picture and smile because I was so confused then. And now it makes sense to me. So just a quick little lesson about why this is happening. So the tooth over here that's kind of shifted 180 degrees, the adult tooth, you can't see it in this image, but is coming in behind it, and it caused the rotation of this tooth. So as the adult tooth was coming in, the roots of the tooth, which are the long parts that are under the gums, were resorbing just because of that pressure of that tooth. And it happened so long that it was undetected that it kind of flipped that tooth. So I found that to be pretty interesting. And then hooray, I matched into my pediatric dental residency in Brooklyn, New York. Unfortunately, this was not my top choice, to be honest. It was not even in my top 3 choice. And what made it less ideal for me is that I matched in a different state than my husband. I matched almost 300 miles away, which was definitely challenging. Earlier in our marriage, it changed a lot of timelines we had as far as family planning and different life planning. So that was a bummer. I cried a lot on match day and for several days after that. But then, pediatric dentistry is an incredibly competitive specialty. And I realized that the fact that I had the opportunity to even become a pediatric dentist was a huge one. And then COVID happened. I remember March 17th, which was a Monday, I was on a pediatric medicine rotation. I got an email from the chair saying any external rotators are temporarily going to be taken off service until COVID passes. And little do we know that we're still in the middle of a global pandemic. But I found it very humbling to work as a pediatric dentist. During COVID, dentistry in many hospitals is under the Department of Surgery. So we were actually drafted to work in the ICUs, which was quite terrifying because as a pediatric dentist, as a dentist in general, we have training in medicine, but not too much training in medicine. And unfortunately, there was some miscommunication, and the team had thought that we were physicians. So in the beginning, it was very challenging because we weren't able to be an active member of the team like the team required, but we were there, and I wanted to make myself useful. So I helped a lot with writing down numbers on, vents, putting in orders, calling in consults, talking to different departments about why certain tests weren't happening or why certain images weren't happening. And it was incredibly humbling to see COVID, take over a hospital a hospital in Brooklyn where a large amount of the population, unfortunately, there had pretty adverse outcomes. Interestingly, so in dentistry, we've had to pivot a lot since COVID came along. And unfortunately, populations that are affected by COVID also experience oral health disparities at greater rates. And Governor Cuomo, who was the governor of New York State at that time, did recommend that all dental offices were closed for any type of routine dental work due to the risk of transmitting COVID through aerosols. And dentistry, especially when you're using a drill or any type of work in the mouth, does transmit a lot of aerosols. So from March 17th, I think, until June 1st, we had no routine dental work, which means kids couldn't get their cleanings, kids couldn't come in for routine dental work. And I have a little bit of a grievance with that term, but that's a topic for another day. And we were only doing emergency services. So in between emergency services and then the ICU, we actually kept quite busy during COVID. And I think the wonderful thing that came from the pandemic, as far as dentistry is concerned, is that we had the opportunity to do a lot more non-aerosolizing prevention-based approaches to dentistry, which I think is particularly important in a pediatric population, as well as in an adult population as well. And then my husband was in Maryland at that time, so my second job was at Dentistry for Children in Maryland. And a couple of challenges I encountered is that I was applying during a pandemic, so in-person visits were very limited, and there was a huge distance. And so your network is going to be your strongest asset. And I actually found my job through a couple of peers and mentors that I had in the dental field. I know, especially when I was applying for this job, I had a lot of, I suffered from imposter syndrome because now I was the pediatric dentist. I was the end of the line for any referrals. So any difficult patients as far as behavior, I would have to handle. And then another uncertainty I had is that my husband was time limited as far as his fellowship. So I knew 1 year from now, I may not be in the same job. So how do I discuss that as far as talking to the owner doctor when I was applying? And then my third job, Rochester, Minnesota, my fourth state. So my husband actually ended up matching in a fellowship here. And I'm in Rochester, Minnesota. I have been for about 2-3 months now. Again, job search challenges similar to before. I actually ended up finding this job on iPedo, which is a very popular Facebook group for pediatric dentists. The owner doctor said, "Hey, we're looking for a pediatric dentist in Rochester, Minnesota. Is anybody interested?" And my eyes lit up. I'm like, this is me. I'm looking for this job. So that ended up working out really well. And unlike when applying for jobs in Maryland, the job search, the dentist market in Minnesota the landscape of dentistry in Minnesota is very different. Minnesota is one of the states in which there's actually a shortage of dentists, and especially pediatric dentists. The office that I'm working in now is one of 2 offices in actually close to a 60 to 80 mile radius. So we see a lot of patients here. It is an incredibly busy practice. And I think to accommodate for that dentist shortage, the structure of dentistry in Minnesota is a little bit different in that there's a lot of expanded function for the dental assistants as well as dental hygienists. So it does allow me to do my job differently and better. The population is very high caries risk, which means that there's a lot of cavities. We actually book our appointments for treatments almost 2 to 3 months in advance. So we're constantly busy and trying to think of innovative ways to treat our patients. So I just wanted this is something that I'm very passionate about. Dentistry, especially pediatric dentistry, is shifting towards doing a lot of things in a minimally invasive way because kids are pretty difficult to treat. If you can imagine treating a 4-year-old that has a very short attention span and is afraid of anything new, we have to think of unique and different ways to treat our patients. So one of the techniques that I kind of just wanted to talk about to give you guys an idea of where dentistry is headed is something called the Hall crown technique. So a little bit about details about how cavities form. Cavities form when there's a couple of things that take place. So one, you need a structure, which is the tooth structure. You need the bacteria, which naturally exists in the mouth. You need some type of fuel or food source, which is what we consume, and you need time. So over time, when any type of food or sugar sits on the tooth, the bacteria essentially metabolizes that sugar, and as a byproduct creates acid, and that acid breaks down the tooth. So that's a quick summary of the pathology and the disease process of cavities. And now we need to treat those. Cavities can present in several different ways. It's usually a soft part of the tooth or a dark part of the tooth. And the conventional way of treating cavities is removing that soft part of the tooth, the cavitated part of the tooth, and then putting in a filling in that area, or restoring that tooth structure. And this often has a needle involved to administer the local anesthesia, as well as drilling. It requires patients' compliance as well as stillness during the procedure. And for a 4-year-old, this is often an uphill battle. So the idea about the Hall crown technique, it was actually first started in Ireland, and it's only become more popular in the United States in the past, I think, half a decade or a decade. Is something called the Hall crown technique, where you can see those blue, I like to call them donuts, are put in between the teeth. And the idea is to create a little extra space so that you're able to put a crown on that tooth. Oftentimes in pediatric dentistry, especially for children, we use stainless steel crowns, which is a silver crown that covers the tooth 360. And that is a really effective way to treat the cavities, because essentially when you cover the tooth 360, there's no way for another cavity to happen on that tooth. But the conventional way of doing that does involve administering local anesthesia, preparing the tooth, and then having the young patient kind of navigate the post-op difficulty with being numb. Children, especially when they're numb, cause a lot of trauma to their cheek or lip because they're biting it, chewing at it, and without knowing, they cause some pretty gnarly injuries to the soft tissue. So Hall crown technique eliminates all of that. So there's no drilling, there's no numbing. I like to talk to my parents about it, that it's essentially like magic. And it's not magic, it's science. So by depriving the tooth from any type of oxygen and food source when the crown sits on top of it, you essentially freeze that cavity. So those anaerobic bacteria that are causing the cavity die because they have no food source. And this can only be done in a very select cases with very specific exclusion and inclusion criteria. But often it's a great way to treat multiple teeth in the same visit, which is a great service to provide to our patients, especially those that have multiple teeth that have cavities that come from a great distance, because doing this treatment traditionally would often require at least 4 45-minute appointments. And especially with children, each subsequent visit becomes even more unpredictable because children are smart. As much as we can use different terms like terms and analogies like sleepy juice rather than the numbing, or like Play-Doh rather than the filling material, kids learn. And I've seen, at least in my experience, that behavior tends to deteriorate as multiple appointments goes on. And I never want it to be a safety issue for myself, for my staff, and for my patients. And I like to do dentistry responsibly. I feel like, especially if patients are moving around a lot and their behavior is not good, my clinical skill is compromised. And I want to make sure that when I'm treating a patient, I'm doing the right thing the first time. And using that Hall crown technique is the perfect way to do so. I've done 8 crowns on all pediatric patients' back molars in one visit on a 4-year-old. And this kid did absolutely amazing. And I could not anticipate doing treatment that well if we were using traditional methods. And a lot of pediatric dentistry now is leaning towards biologic and like the medical model, where you're treating the source of the problem, not just treating the problem itself, not finding a band-aid. You're actually looking into the etiology of the problem and doing things in like a biologically driven way. So that's pretty awesome. That's something I'm looking forward to learning more about. Okay, so that's a little bit about my career with a handful of clinical cases. I did want to quickly talk about some things outside of the dental world outside of the purely clinical world that I'm passionate about. organized dentistry is a huge thing in our profession. It is the non-clinical side of dentistry, in which there's three different kind of levels of organizations. You have the national organization, which is the American Dental Association. You have state components. Each state has their own chapter, and like local organizations also have their chapter. I had the opportunity to be involved in organized dentistry from a dental school level, and through that I received a lot of great leadership training, leadership experience, and honestly, some of the people I've met are the biggest asset that you can get from participating in organized dentistry. Think of it as extracurriculars now that you're a dentist, especially since I've moved around in so many different states and I've practiced dentistry in so many different areas. The only way that I kind of find comfort in the dental community is through organized dentistry. Anytime I move to a new place, I talk to my other peers and I'm like, hey, do you know anybody in this state? And that's actually how I got my job in Maryland. And I found that to be great, because I was coming from New York. I was born and raised there. I had no connections in Maryland, but through talking to my organized dentistry mentors and peers in the New York State, I was able to find a great job connection in Maryland. I was actually lucky enough to have the opportunity to participate in the ADA's Institute for Diversity and Leadership. And this beautiful and intelligent group of dentists was my graduating class from 2018 through 2019. It was a great leadership course for diverse dentists where you learned a bunch of skills and you actually conducted a project. And we actually still keep in touch pretty often. We have trivia nights, and through this, I've had the opportunity to do quite a few things, like serve as the vice chair of the new dentist committee, as well as do some other great opportunities that I have now. And then social media and dentistry. Since I actually first started my page, I have quite a lot more followers. So this is a little plug for me. Please follow my my Instagram page, The Mighty Tooth. I'm trying to find my voice there. I kind of go through different stages about how I want my page to be focused on. And in the beginning, I was pretty stressed about that, but I think that's really exciting and liberating now, that I'm constantly changing whether I want to be patient focused, dentist focused, pre-dental focused. So I'm kind of trying to find my voice and create value in my in my content. And the thing that I enjoy the most is that there's a great community of dentists out there. And dentistry, unlike what I thought, is pretty lonely. You go from dental school to residency, where you have a group of peers with you, to often practicing alone in a practice. And that I found to be very lonely, and I struggled a lot with in the beginning. But then I realized that I'm not the only dentist. There are dentists around me. Just because we're not working in the same building, that doesn't mean we can't collaborate, ask each other questions. So through social media, I'm able to kind of connect with other dentists, not only in the States, but around the world, and learn from them, engage with them. So I found that pretty awesome. And that's it. I have a weird collection of all these things from childhood that have little dentist mentions. So maybe it was destined from the start. So this was a cute little thing that my mom found for me. And you can see on the banana that the banana keeps the dentist away, which is actually ironic because some of the ingredients found in bananas actually help to keep your teeth healthy. So I have my Instagram plugged there, which is at The Mighty Tooth, and then my email address. Please feel free to email me if you have any questions, concerns, questions about my presentation, questions about applying to dental school, whether or not being a dentist is the right choice from you. I like to be very honest and candid. I may take some time to respond, and if I don't respond within like 5 days, please message me again so it pops to the top of my inbox, and I'll be happy to give my advice wherever you would like. And I think that's good. I'll leave some time for some questions.
Great. Well, thank you so much. First of all, Dr. Khan, it was really, really nice seeing your background. Every speaker has their own story to tell, and with you visiting so many places, not only in training but still in practice, all the jobs you went to, you bring forward a lot of experience that's so exciting to hear, and also the cases, they are very, very nice to hear. We'll dive into a few questions with the time that we have left. And for those listening, if you do have any questions that you'd like to add, feel free to still type them in the chat. We might be able to get to them. Our first here is about extracurricular experiences. So looking back at your undergrad years, is there anything in particular that you can think of that you wish you would have done extracurricular wise that you didn't get the chance to?
I honestly wish I was more active in my pre-dental society. For some reason, so honestly, I think what happened was the meeting time conflicted with some classes that I needed to take, and I wasn't able to participate in that. So I went applying into dental school without the normal community and peers that were applying to dental school. Many of my peers were applying to medical school, and there is a little bit of a difference as far as the requirements. So I found my resources as far as other people to discuss pre-dental related things to just limited, because I wasn't exposed to the great benefits the pre-dental society would offer. So if your local school does have a pre-dental society, I would highly encourage you to get involved, because it's just a great way to keep in the know about different happenings in the dental field, especially tips as far as studying for your DATs, as well as different shadowing opportunities that would be available to you.
You discussed some interview tips earlier in your presentation. So from your days when you interviewed, what were they like? Was it one-on-one? Was it group interviews? What type of interviews did you see?
So there's a wide variety of interviews. One-on-one, I believe, is the most standard one. They also have interviews that are group interviews. So it's yourself and several, usually 2 or 3 other dentists. And then there's also situations, I've only had one of them, where it's, oh my gosh, it was so intimidating. It was like a round table where they had several pre-dents and several doctors, and it was kind of like a free-for-all as far as how to answer. I forget what school that was, but you have to balance between, giving your voice but not talking over other people. And one thing that I found very unique is that certain interviews are closed book and certain interviews are open book. So certain interviewers will know your entire life story. They'll know your extracurriculars, your grades, your undergraduate history, and they can ask you questions that way. And then I've had several interviews that the only thing that they know is my name. And then we kind of have a conversation through there. I found those types of interviews to be more enjoyable, because it was more like a conversation. They knew I was qualified enough to have the interview, and it was more getting to know me and getting to know my interests and my future career goals.
Just a follow-up question to that about the closed book interviews, in that they don't necessarily know really anything about your story behind the application. Do they ever get around to discussing that, or is it more about you as a person? Like, did you ever disclose any of that? Did they ever go into that, specifically asking questions, even though they didn't know anything?
That's a good question. So sometimes you naturally, when talking about yourself, you do give your background, but I found that the interviewer wasn't so keen on knowing like what classes I took or what my extracurricular was. It was more a conversation about my interests, and it was kind of more a get to know me opportunity. But oftentimes you will get asked a question, tell me about yourself. And I think that's a great opportunity to tell your story. But I wouldn't regurgitate anything that's already on your resume or already on your personal statement, because they can reference that information afterwards. They want to know more about you. So I would always recommend that in your personal statement, leave something out that you can tell. So it's not something that the interviewer has already been exposed to.
A lot of your training and practice has been on the East Coast. Have you ever considered moving to the West, or have you heard any differences between what practice and training is like on the East versus West from colleagues?
It's pretty standardized as far as dental school curriculum is concerned. I have found practicing as a dentist in the Midwest, specifically Minnesota, to be very, very different, especially in states in which it's not as popular to live in, like New York, California, Texas, Florida. Those major states, they have usually like a plethora of dentists, and by working in a state that's less common, I think you have more opportunity and you have the ability to kind of rise to the occasion. I know I was very intimidated when I was moving to Minnesota because the caries risk is so high. And I was like, am I able to provide patients the level of care that they deserve? But states are actually very intelligent in how they structure their other allied dental professionals, like dental assistants and dental hygienists, in their licensure. Those ancillary staff is actually able to do more. So my role as a dentist has kind of changed. I'm able to work much more closely with them to deliver care to patients. So I've worked in like 3 different offices in 3 different states, and I love my job in Minnesota the most. I feel like everybody is very motivated and everybody's very excited. And especially since the dental assistants have a larger capacity as far as what they can do, I feel like they're a lot more hands-on and we're able to do a lot more care for the patients. And that really helps to reduce the burden of the high caries risk population.
You mentioned some other specialties, just kind of lightly touching on them throughout your presentation. Do you kind of work with a certain specialty? Like we had actually a few now. We had one pediatric dentistry session before this one. We had an oral medicine session and a few others. But are there any specific specialties that you're really close with in terms of just referring? Maybe it's just because you're in a certain location, or just generally the truth for pediatric dentistry?
Sure. The cool thing about pediatric dentistry is, since it's the only age-defined specialty, is that we work with everybody. Very, very often, I'm referring patients to orthodontics to help, monitor their growth and development, to any type of braces intervention. Endodontists, especially if young patients have needs that related to root canals, oral surgery as far as pathology. So I refer very closely to all the specialists. I think the specialist that I would work most closely with would be the orthodontist, because many kids, especially during their mixed dentition phase, which is between usually 7 and 10, they have various orthodontic needs. So we refer most closely to orthodontists, but I do work closely with all specialties. This week alone, I think I've referred to an oral surgeon and endodontist. I think the specialty that we interact the least with would probably be periodontics, which is gum disease and bone disease, because that's generally a disease that affects older patients more. And if it is affecting a child, chances are they do have some other complicated health issues that are going around, in which case we would talk to their pediatrician.
And then moving forward for this field, where do you see pediatric dentistry going? Do you feel like there's anything specific in terms of the advances that we'll see to pediatric dentistry, or is it going to kind of ride along with the wave of general dental advances?
Great. So that's an awesome question. And that's something I'm actually really interested in as well. I did mention the Hall crown technique, which is an entire arena of minimally invasive techniques where you can use different materials and different techniques to treat a cavity without actually drilling it. There's this wonderful medicament called silver diamine fluoride, which we use very often in our patients. And it's a combination of silver and fluoride. And it acts as an antibacterial agent, as well as the benefits you get from fluoride. And it's this liquid that essentially you brush on a cavity and it arrests that cavity. And there are all these new thoughts and technologies going into that. Oftentimes in pediatric dentistry, we're using materials that are not only biocompatible, but like biofunctional. So a lot of the white colored fillings that we use now are actually fluoride releasing. So as the patient is drinking water, they're using toothpaste, that material gets recharged and kind of redistributes fluoride throughout the dentition. So that can help. Another place where pediatric dentistry is going is a lot through functional dentistry. A lot of research is going into airway health. So the tongue is one of the most important muscles in the body, at least I would say so. And the positioning of the tongue, the mobility of the tongue relates a lot to the growth of the palate and growth of the nasal apparatus, because the floor of the nose is the roof of the mouth. It's the same structure. So relating all those things, pediatric dentists are looking into how a child is growing, how their tongue is postured, and whether that relates to their ability to breathe correctly. A lot of the push is going towards nasal breathing because there's a lot of benefits to that as opposed to mouth breathing, which not only causes issues as far as oral health is concerned, but a wide variety of systemic issues as well. There is this book that I read recently, or I listened to recently, called Breathe, and that book is fascinating. It talks about all those functional related things relating to nasal breathing and related to the posture of the tongue. So that's where the future of pediatric dentistry is. It seems to be integrating a lot more closely into more of a medical model. And I think, at least I hope, that dentistry is going to grow to be more valued, not only in society, but other physicians as a part of your health, not just that the mouth is separate from everywhere else.
Yeah, actually, our next question is just about that. How close do you work with physicians for referrals across medicine to dentistry or vice versa?
Sure. So when I was in my GPR residency, as well as my pediatric dentistry residency, because we were in a hospital, we worked very closely with physicians, especially patients undergoing very complicated cardiovascular surgeries, as well as patients that are going to have some type of chemotherapy or bone marrow transplant, organ transplant. Is very important that the patient's mouth is healthy, their oral health is optimal, because a lot of the bacteria that's in the mouth can cause different issues and concerns with the rest of the body. So on one end, a lot of physicians ask dentists to provide dental clearance prior to any type of procedure, which basically involves us making sure and triaging that there's nothing acute that can cause an infection or a problem. And on the other hand, especially when we're seeing patients with complex medical histories, everything that we do in the mouth is dealing with blood vessels, you're dealing with an airway, you're dealing with nerves. So you do want to make sure that the patient is healthy in that way, that there's nothing that you do at the office, whether it's administer local anesthesia, have the patient lying down, give nitrous oxide or laughing gas that would exacerbate anything on their medical end. So very often we are referring to our medical colleagues for risk stratification of any type of procedure we're doing.
All right. And I think we're going to end off today's session on just one more question. You touched on research earlier, an interesting case that you thought would be good for a publication. How important, or at what stage does research actually become important in dentistry from your experience?
My experience is that research is more important in dental school, especially in more research heavy fields. My understanding is that periodontics and endodontics are, if you want to specialize in that subspecialty, they do require more research, and they do look for longevity as far as in a research lab and even publications. I know research and publications is a huge thing in the medical school process as well as in a physician. I don't think it's as important in dentistry, but that's usually for general dentists. But I think if you are interested in going into a more competitive or scientific driven field, research becomes more important, and kind of just, it's not so much research, but it's the ability to kind of critically think and answer questions in a systematic way. I think the ability to have that thought process and work through an algorithm like that, I believe that's more important.
All right. Well, that wraps up today's session. Again, thank you so much, Dr. Khan, for joining us. This was such a great session. I'm very, very glad that we had it today. And for those who are listening, I do have a few last things to say. So to earn credit for your attendance today, you must pass that quiz, which is now posted in our chat box. It's also available on our virtual shadowing page. So either of those two will work. For now, I think we're having some issues with our virtual shadowing page, but we'll be sure to fix that soon. So try to just stick with the one that we have in the chat box, just a Google form link, and you can click onto it. It's going to guide you on to 10 questions. You need to pass with 6 or more of those correct, or 60%. And that quiz will be due next week on Wednesday, October 26th at 11:59 p.m. Central Standard Time as usual. After passing that quiz, you'll receive a certificate. That certificate will be sent to the inbox of the email address that you list on the quiz. So be sure to list an email that you're comfortable with. We recommend a personal email. Sometimes school emails will filter out things. So another thing is, if you do not find it in your inbox, please check your spam folder. But as always, we're always happy to help. And if you don't find in either of those folders, feel free to get in contact with us. Again, our email is shadowing.h, the number 4h at gmail.com. And next week, we're going to continue with more shadowing sessions. We will not have a shadowing session on that Thursday of next week, but we will on Monday, October 24th. We're going to be joined actually by a pediatrician. So this kind of goes along with our pediatric series here. We'll be seeing him at 7 p.m. Central. Dr. Obidi is his name, and he's going to be a board certified pediatrician. I know that a lot of you are very excited for our pediatric sessions, both on the medical and dental side. So I'm sure we're all enjoying these sessions during this time of year. Again, to stay tuned with us, feel free to either follow us on Instagram or subscribe to our listserv. Either are great ways to get in touch, or not get in touch, but more so just stay in tune with what we have to offer. Also, Dr. Khan, she included her handles and the email address that she has on her PowerPoint. If you don't mind just quickly sharing your screen for any students who might be interested in getting in touch.
Or there you go.
Yeah, so if you do have anything that you'd like to contact Dr. Khan for, I'm sure that she'd be happy to answer her. Give her a follow on Instagram, show some support. And I want to see some thank yous in the chat for Dr. Khan. This was such a great session today. We're so glad to have you. But yes, I hope everyone has a great rest of your night. And thank you again so much, Dr. Khan, for your time.
Thank you. Have a great night. Hope everybody enjoys.